Good afternoon, ladies and gentlemen. On behalf of Manila House, this is Bambina Olivares, the Director of Programming, and I'd like to welcome you all to today's webinar, brought to you in partnership with Life Science, about pandemic survival. It's a pandemic survival guide on how to safeguard your mental and physical well-being during this time. We have been under the world's longest lockdown, 12 months this month, since we were first placed on ECQ. Sinovac has already arrived, but I know most of us are waiting for the other COVID vaccines, such as Pfizer, Moderna, and AstraZeneca, and it'll be some time till we can say we are truly safe from COVID-19. Still, it's quite challenging not to go quarantine crazy, and today we have three specialists who will discuss strategies and hacks to help you get through the last stretch. Dr. Aisa Yamamoto, a functional medicine doctor, Von Guintu, a psychologist, and Jason Villanueva, a nutritionist and dietitian. To introduce you to Life Science and our panel of specialists is Life Science Brand Manager Luis Samonte. Just a few notes before we begin. This webinar is being recorded and will be up on the Manila House YouTube channel in a day or so. If you have any questions, feel free to use the chat box and the Q&A box, and we'll try to get to all of your questions during this session. There's going to be a raffle later on. Luis will tell you all about the prizes and special honors. Special offers, sorry. Luis, will you do the honors?
Hi, everyone. Thank you again for joining us today. Let me just share my screen. And hey there. Hi, everyone. Thank you again for joining us today. Again, thank you, Bambina, for helping us set up this webinar. So as Bambina mentioned, we have a panelist from our care team, and we're lucky enough to get the superstars of our team here today all together in one talk, in one webinar. So let me start with our clinic. As you might have known, or if you don't still know us by now, we are a Life Science Center and we're under the Romulus group of companies. And basically our objective is to give Filipinos access to the best global practices in health and wellness. And we have served already at least 5,000 clients and counting. And we're still growing, and we're very proud of our care team of doctors, health managers, and nutritionists, and health coaches and psychologists who are all working together to make sure that everyone will live their healthiest and happiest life. And we are the premier functional medicine clinic in the country. And a lot of people would ask us, what is functional medicine? So we're very proud of this because we're the first clinic to bring in this kind of practice here. And functional medicine basically is an approach that helps us determine how and why your health condition exists. And it allows your care team to figure out and give you long-term solutions instead of short-term band-aid fixes to address your concern, your disease. So this practice, takes extensive training, and our whole care team is trained in this approach. So without further ado, let me introduce our care team today. First is Dr. Aisa Yamamoto. She is one of our life science functional medicine consultants. And Dr. Aisa is a graduate from the University of Santo Tomas and was a summa cum laude. She also did training at the Albert Einstein Medical Center in Philadelphia, Pennsylvania, and she was trained in functional medicine by the Institute for Functional Medicine in the US. They're basically the Mecca Institute globally for the approach. And she is one of the few only certified functional medicine doctors in the country. And I'm telling you guys, the certification process alone is very hard. And her being a certified doctor is very much an honor, and especially for life science to have her as part of the team. So next would be our psychologist, Von Guintu. He is currently the crowd favorite recently in all our webinars. Von studied his master's in psychology at Ateneo de Manila University, and he got his certificate to be a facilitator for mindful-based cognitive therapy from the Center for Mindfulness Studies in Toronto, Canada. He is also a contributor and co-authored certain publications on mental health and mindfulness. So he will talk about a lot of things, especially when it comes to mental health later. And lastly, we have Jason Villanueva, our life science nutritionist dietitian. And what's nice about Jason, what's unique about Jason is he's one of the few, well, the only one that we know who is both a nutritionist dietitian and a chef. He is a culinary arts graduate and is a board certified nutritionist dietitian. He was a dietary supervisor before joining Life Science as one of the team's functional medicine trained nutritionist dietitians. And he specializes in helping patients diagnosed with diabetes and those with weight loss health goals. So let me turn it over to Dr. Isa Yamamoto, where she will talk about the functional medicine tree. Dr. Isa?
Hi, good afternoon, everyone. I guess let me start by saying thank you for allowing us this opportunity to share our insights, and hopefully, everyone can learn a thing or two from this webinar. Uh, just going back to what Louise was saying about the functional medicine approach. Basically, it's trying to look at and trying to understand what the root cause of our topic is, quarantine survival guide. I want to point out that your risk and your ability to maintain resilience against the physical, mental, and emotional effects of our current environment because of course the pandemic, the new normal. It's related to a lot of many different factors, and that there isn't really one magic pill or a silver bullet or that singular intervention or procedure, I guess, that that can instantly make us become successful when it comes to surviving and thriving and adapting to the new normal. And that's a good thing because we don't have to rely on just one thing to become successful. There are a lot of things that we can do, and it's something that we can tailor fit to our current condition, to our preferences, to of course our beliefs, basically just our current state. And again, the functional medicine approach really, what we like to say is that it's the standard of care plus roots cause medicine. Being an allopathically trained physician, we don't really say that it's what the traditional practitioners are recommending. Like if you're on maintenance medications, like if you need to undergo surgery or if you need to undergo chemotherapy, radiotherapy, okay, that's the standard of care. It's not something that we would say, you shouldn't do that because this approach is better. Instead, what we do is, we look at the other things that we can do for you, or that we can help you with in terms of supporting you achieve whatever your health goal is. And again, it's trying to find what root causes are. And at times it can be a bit complex, but we like to simplify it by trying to look for whether or not there's something that's happening in a person that's there's too much of it, or there's too little of something. Do we need to add something? Do we need to remove something? Do we need to fix how certain factors interact with each other? So this is the functional medicine tree. So basically, it's a representation. It captures the essence of the principles of what we do in functional medicine. Here. So at the very, very top, the leaves in the tree. These are, some of the main reasons why people they seek help from healthcare practitioners, whether it's a doctor, a nutritionist, a psychologist, or even a health coach, a life coach. Diseases, how we label them, these diagnoses, that's what most people go to seek help for, whether it's an illness that you got diagnosed with, whether it's a risk factor that runs in the family, a disease that runs in the family, or for example, just trying to understand how to make lifestyle changes to help manage a certain condition that you got diagnosed with. That's why you come see healthcare practitioners. But what I'd like to point out is that these illnesses, these manifestations, these signs and symptoms, they begin happening much earlier than before you seek help. And the goal here is really to try to catch these imbalances at the earliest possible time, so that there's more we can do in terms of trying to address it, and even at times trying to reverse it or to prevent it from getting worse. Um, So what we do is we try to look at what signs and symptoms you have, and not just to keep it in a silo, no, to make it isolated. Na okay, you have gut symptoms like you have bloating, you get an upset stomach when you eat something, or you get rashes, you get allergies, or you have hypertension, you have a history of heart disease, you have diabetes. Diba? It's not looking at one disease as a single entity. You know, it's understanding that all of these diseases, all of the symptoms and signs that you have, they're all interconnected. And that's why we try to look for the root cause. And we try to group them into what we call the core clinical imbalances. Okay, here. So this is what I was talking about earlier. So we kind of try to group the root causes, no, behind whatever symptoms that you have, whatever illnesses that you have, into these 7 nodes. And we can kind of try to relate it to the way that organ systems are grouped together. Like for example, if we're talking about gut health, no, we're talking about assimilation, talking about the digestive system, we're talking about your other organs like the liver, diba? Or your respiratory system is also included there. But we also look at your gut health in terms of the microbiome. I know Dr. Rona in her last webinar kind of touched on this a little bit, no? The population of bacteria in your gut. Or if we're talking about your immune system, we look at the defense and repair node. No? When we talk about there's too much inflammation, there's immune dysfunction, that's kind of the node that we're talking about. But, you know, much in the same way that certain illnesses, certain diseases, certain symptoms are all related to each other, these nodes are also related to each other, wherein a problem in one node, for example, you have a lot of gastric symptoms, you get bloated, you get abdominal pains, you get an upset stomach frequently. It's related to, let's say, for example, too much inflammation. Diba? That can be manifesting somewhere else, somewhere completely different. Like, for example, you get mood swings, or you get skin lesions, diba? Or you have a problem with liver function. Again, it's all interrelated, wherein a problem in one node definitely affects another node, or can even affect, you know, all the nodes. And the key there is trying to figure out the connection. So it's like understanding where to begin when you want to solve a puzzle, or when you want to get through a maze or a labyrinth, or when you're trying to do connect the dots. Diba? It's understanding where to begin and how to get to your end point, no? Whatever your health goal is. And by doing so, we're able to identify certain leverage points. No? So let's say, for example, if you have too much inflammation, maybe it's something that we need to start addressing. And later on, we'll touch more on what these leverage points are, specifically your modifiable lifestyle factors. In the case of too much inflammation, what can we do with your lifestyle factors to address too much inflammation? Or if you want to talk about gut health naman, you want to talk about skin health, ganun din. We look at how the food you eat, how you sleep, how much stress you're undergoing currently. And then there's the antecedents, triggers, and mediators. So this one naman, I like to say is the elements in your health story. You know, when we talk about antecedents, these are the things that happened before you started manifesting with certain symptoms, with the disease that you got diagnosed with. It can go as far as when your mom was pregnant with you, or when you were growing up, or anything that happened in the past that led to you being more predisposed to manifest with a certain illness, to manifest with a certain symptom. And then when we talk about triggers, more often than not, these are kumbaga parang big life-changing events. It can be being hospitalized, it can be an accident, it can be moving somewhere else, or changing jobs, things like that. That might have been the tipping point, kind of pushed you over the edge, where you started manifesting. So basically, these imbalances were happening na, parang small fires, and then something happened, parang nagdugtong na all the small fires. Now it's really manifesting with a full-blown disease. And of course, mediators, when we talk about mediators, these are the factors that you currently have. And it can be genetic predisposition. Again, it can be the lifestyle that you have. the current practices that you have. And when we are able to identify these, and when we start cultivating self-awareness, we can again have a better understanding of what the leverage points are for you, to help you achieve your health goal. Not, if for example the goal here is to learn how to kind of survive the quarantine, how to survive the pandemic, how to adapt more to the new normal. Yeah, those are good places to start looking at. Okay, here. So the mental, emotional, spiritual influences. Again, these are some of the factors that I mentioned earlier, wherein when you talk about making your immune system more resilient, for example, making your health, your body, your mind, your emotions, making it more resilient. Again, you have to look at how these factors interact with each other. And even if, let's say, for example, there's a genetic predisposition, like a specific illness runs in the family, your genes aren't your destiny. You can absolutely do a lot of things to change the expression of your genes. Like, for example, if breast cancer runs in the family, it doesn't necessarily mean that, if, for example, your mom or a first-degree relative had breast cancer, that you automatically have it. Yes, you are at an increased risk, but again, there are a lot of things that you can do to help decrease that risk, or, to actually prevent that from happening at all. And again, the bulk of this webinar will be looking at your modifiable lifestyle factors. And I think this is also something that Dr. Rona touched on a little bit from the last webinar. So specifically, we want to talk about sleep, nutrition, movement, relationships, and stress. Basically, if you remember from the last webinar, or siguro I'll just bring it up again, we look at illness and wellness in a spectrum. And the goal there is to find out where are you? Where am I in the spectrum? Where do I want to be? Diba? And then we need to figure out how to get you from where you are, how to move you towards the optimal wellness that's specific for you. Diba? Whether it's trying to reverse a disease, whether it's trying to prevent a disease from happening, or for a disease to progress. Diba? Or even if we're just talking about kumbaga parang making everything optimal, making everything conducive to you having the best health that you can. And then what we'll try to do is talk about your practical tips that everyone can try to do, ultimately to help with optimal health and wellness. Okay, so we'll begin with sleep. So of course, sleep is important. In fact, a lot of studies show that even just one night of poor sleep, meaning to say, pag poor sleep, we're talking about poor quantity and poor quality. You're more likely to not be as productive the following day. You're more at risk for developing chronic disease, or if you do already have chronic disease, you're more likely to have disease progression, and it's more difficult to control. Like for example, in the case of insomnia, it starts a vicious cycle. When you have lack of sleep, the following morning, you feel tired. You're not able to do things that you need to do. Your judgment and your insight can be impaired. You might have brain fog. And of course, when we're talking about your immune system, the immune response can also be impaired. That's why when people have difficulty sleeping, it's very important to start understanding why. When you talk about difficulty sleeping, is it falling asleep? Is it maintaining sleep? Or do you wake up very early in the morning and you try to go back to sleep? Or are you someone who works on a night shift, wherein you need to sleep during the day? These factors have an impact when it comes to optimal sleep, getting the right quantity, getting the right quality of sleep. And again, there are a lot of the things that we can focus on when it comes to sleep.
Yeah, and may I just add, I like how you presented kasi Doc Isa the functional tree. Now it's these things, these modifiable lifestyle factors are at the bottom. Kasi this is where it all starts, and this is where we have the most power, so to speak, because this is where we can do a lot before pa siya maging, what was the word that you used kanina, maging full blown or something, or the full expression of a disease. It's in these areas specifically, right now we're talking about sleep, but yeah, kasi this is so crucial. Like what you said kanina, I can't help but think about how sleep affects our autonomic nervous system, for example. Kasi a lot of the things that you were talking about are actually controlled by the autonomic nervous system, yung pag-regulate sa katawan natin. And you're right, no? Kasi parang I've seen those studies that, for example, ang tawag doon, that affect our immune system, that the amount of sleep is directly related to the quality of yung functioning of the autonomic nervous system that controls our immune system, basically.
Yeah, that's a really great point. I think when it comes to sleep, we can relate it to a lot of different symptoms or illnesses. And in fact, just going back to the lifestyle factors in general, you can even, for example, you can even change the way you eat to help you get better sleep, diba? Or you can change the way you address stress so that you can have better nutrition, diba? Things like that. Pwedeng connected din lahat ng modifiable lifestyle factors. That's what's good about it, diba? Kasi again, if this is where you should be focusing your attention on, diba? Parang small changes, big impact. Na you're not just, for example, you have obesity, diabetes, and hypertension. Diba? When you address sleep, you're not just addressing diabetes, you're not just addressing hypertension, you're addressing everything. Diba? The same goes for all the root causes that we can identify.
Yeah, and I can't help but think, for example, kunwari, because the amount of sleep directly affects the health of the autonomic nervous system, but if you start thinking about the autonomic nervous system, ang dami niyang kinokontrol, particularly, it's essentially what's responsible for how we behave. Because it's what we use to interact with the world, right? And I can't help but think that one crucial function, for example, of the autonomic nervous system is that it serves as a detection system. It's what we use to interact with the environment, right? So in order for it to start doing that effectively, it has to know, or it has to function well in terms of picking up signals of safety and signals of danger. Now, I can't help but think that if our autonomic nervous system is dysregulated, for example, then that means even though your environment is safe enough, you're in your bed, it's soft and comfortable and all of that, if your autonomic nervous system is somehow, because it's dysregulated, it's picking up signals of danger, then it's no wonder that, for example, that it's difficult for you to sleep because on an unconscious level, subcortically, so to speak, it's telling you that there's danger, and here you are wide awake at night and wondering, why the hell can't I sleep? Parang that's why it's so important, I think, in that we focus on these modifiable lifestyle factors, like what you said.
Dr. Isa, coming from what Von and what you discussed in Von, what will happen if we don't get quality sleep continuously? I mean, what are the other symptoms that people might, brush off, but yung pala, it's actually a sign or your body warning or telling you that you should get more quality sleep? Kasi like me, I don't know if I'm getting quality sleep or not, but I'm experiencing symptoms sometimes.
Yeah, okay. So again, when you don't get the right amount or the right quality of sleep, it can have physical effects, it can have mental effects, it can have emotional effects, which are all tied together. So for example, I think the most common symptom that are the patients I see, the one that they notice is really lack of energy, even the ones that work on a like they say I sleep 8 hours, but I have to get up in the morning, etc. Um, yung ganun kasi na kind ng sleep, it's not as good yung quality as when you at night, or for example when you sleep beginning a certain hour of the night, so different in quality. And again, it can impair yung focus mo. You can get brain fog. It's more difficult for you to concentrate. It's more difficult for you to recall things. And that's why, in med school, I remember we really would try our very best to get a good night's sleep before taking a major examination. And then, of course, when you talk about your immune system, sleep really has a huge role. That's when your immune system is most active, when you're sleeping. Kaya nga when we were kids, if you're sick, if nilalagnat ka or things like that, they would tell you to sleep, diba? Or even like for example, you go to the school clinic, you say, "Oh, I have a fever, I don't feel well." They prescribe bed rest for you. They prescribe sleep for you, and you need to really get 8 to 10 hours of sleep. Again, that it's because that's when your immune system is most active. That's when it tries to repair itself. I guess emotions. Siguro, correct me if I'm wrong, Von. No? When there's lack of sleep, you're more cranky. You're more less likely to have a pleasant interaction with other people. I don't know. Maybe it's something that people also notice from you. Na okay, maybe he or she didn't get enough sleep, and that's why, diba?
That's so
It's
true,
true. It's
Dr.
true, though.
Isa.
Yeah.
Yeah.
And there's a reason for it. Like I said, this is intimately tied with the autonomic nervous system, which incidentally controls sleep, right? Because like I said, think of the autonomic nervous system as our detection system. So can you imagine a nervous system that is dysregulated and keeps telling you that there is danger? Then that would, of course, color, quote unquote, color the way you see the world, the way you would interact with other people. It's why we're cranky, because on a cognitive level, we know that we are safe. All right, we tried to sleep and all that. So we're talking to this person, we're talking to our classmates, professors or whatnot. But subcortically, like I said, on an unconscious level, the nervous system is still dysregulated. So it's still sending those micro signals to your mind that it's not safe, maybe. So that's why maybe you see differently, you hear differently what they say, you have a different interpretation, especially those moments when you did not get enough sleep, like maybe you misinterpreted an eye roll, and the story that you come up with, the story that your mind comes up with is that, oh my God, this person hates me, right? So
Yeah.
ganun siya, right? And there's a reason. Yeah, it's amazing, isn't it?
Mm-hmm.
Yeah.
Yeah.
So what's nice about this is you both were able to actually highlight or parang explain the science behind sleep. So now what I would want to ask is, well, one, how do you get quality sleep? I mean, I know Dr. Rona was able to touch on this last time, but it's interesting to hear naman from another set of professionals. So what are your, let's say, top 10 tips from a doctor's perspective and from a psychologist's perspective on how you can actually get your night's worth of sleep?
Sige, let me try to, I don't know if I'll exceed the 10 or baka kulang pa, but I'll try to give at least the things that I do for myself and what I most recommend to my patients. Again, it's, the first thing you need to do is to understand, diba, what do you mean by I have difficulty sleeping? I have insomnia, diba? Kasi it can mean different things, diba? Again, are you having difficulty falling asleep? Are you having a hard time maintaining sleep? Do you get up very early in the morning? And if so, why is that? Does that mean that you need to go to the restroom, or you feel that you're a light sleeper, or you have vivid dreams that you feel like you're so tired when you wake up in the morning? So it can be, I don't know, different. But there's what we call sleep hygiene. It's paying attention to the things that you do before sleep, paying attention to the environment that you sleep in. Is it conducive to sleeping? And of course, the time that you sleep, no? Like for example, if when people ask me, okay, what's the optimal time that I should be at bed na, no? What I usually recommend is try to go for 10 to 11 p.m. Kasi right around that time, no, mga 10, 11, up until maybe like 1, 2 a.m. 2 a.m. is kind of pushing it, but maybe like 1 a.m. When you sleep, starting at that time, no, your body spends when you sleep, no, your mind spends most time in the non-REM, no? So that's when you're resting. Kasi pag dun sa REM, that's when your dreams happen, parang gising ka pa din, no? Your mind is awake and your body is also awake. That's why if you have vivid dreams palagi, sometimes you wake up na parang feel like I didn't sleep, no? Or for example, you're tossing and turning, ganun din, you don't feel rested. So yun, no? And then try to maintain a sleep schedule, diba? If you have an alarm set for waking up in the morning because you have to go to work, because you have to prepare meals for your kids, or because you have a meeting, do the same thing for when you sleep, because that's putting importance to sleep. Diba? Set an alarm, like for example 9:30. Okay, 9:30 I should start doing my sleep routine na. If you're the kind of person who enjoys a warm bubble bath before you sleep, you can do that. Or if you want to read a book before you sleep, you can also do that. And ideally, I know this is going to be tricky, but ideally, stay away from yung mga blue light, exposing yourself to blue light at least an hour or so before you sleep. Try to avoid using your cell phone pag nakahiga ka na, or minimize the electromagnetic signals. Like for example, if there's cell phone or other electronic devices in your room. And of course, again, pay attention to your sleep environment. Look at the temperature, look at the lighting, look at the sounds, diba? Pay attention to the sounds. Sometimes for other people, it's the bed sheet, diba? Or what else? I guess it's just the overall look and feel of your bedroom. That's also very important. And again, other things to pay attention to is, for example, you're getting a lot of reflux symptoms right before you sleep. Okay, what could have triggered it? Or did you drink too much caffeine? Or did you exercise like at less than 3 hours before you sleep? Or did you have an argument with someone? Did you have a very stressful meeting? So just being aware of those factors that affect sleep is a huge thing, because that's when you can start taking steps, diba, to address what the potential causes of poor sleep are.
Yeah. Ako naman, I'll chime in with the, I guess I can't help it, with the psychological perspective to it, right? I like what you said, Doc Isa, kasi some of the practical things that you were recommending are actually, especially if it's a routine already, especially if it's a routine, it kind of sends a signal to our mind that it's at around the time that it's about to relax. So if you make it a routine, it's going to be automatic. But yeah, just to add to what you said, because if you think about, for example, what makes it difficult for a lot of people to sleep, it's when their minds don't stop, right? Like technically, it just runs and runs and runs. Problem solving, figuring it out, running it over in your head over and over, and then it doesn't come up with a satisfactory answer, and so it tries harder. Now, what that does, I'll tie it again with what it does to our autonomic nervous system. Those kinds of thoughts then put you in a state of, in a sympathetic state where you're in a fight-flight state. And that does a lot of things to your body. Like it shoots up blood pressure because your nervous system thinks that you are in a fight-flight situation, therefore making it harder for you to fall asleep, right? So it's in with these in mind that some of the things that we learned in mindfulness-based cognitive therapy come in handy, because we're all here. The gears just keep on turning and turning and turning. So what helps? But can I just say at the onset that it's easier said than done, right? Because it takes it takes a certain amount of practice that you keep doing it before your brain actually starts getting used to it. So what's helpful is for us to find a way to turn that off. And I, okay, maybe that was too strong a word, but to really not to turn it off, because that would mean you're dead, right? But
Maybe like dial it down or something.
right,
Like that.
dial it down. There you go. Dial it down, way down. So what helps is to, we call it coming home to the body, coming home to the body. Because if you're here and it makes up these scenarios, usually because we have a negativity bias, it comes up with the worst case scenarios, right? That's why we get so ugh. So if we come, quote unquote, come home to the body, then it's an effective way to remind our brains that we're actually safe, that we're actually okay. That's the whole reason about how in meditation they keep asking you to focus on your breath, and they have specific ways of breathing so that it sends the right signals. Because if you breathe in a certain way, that's also sending signals to the brain that, or to the autonomic nervous system rather, that that might alert it to certain states. So we want it relaxed in that moment. So coming home to the body means focusing on your sensations. Like, instead of running things in your head, maybe reminding yourself to feel what the bed sheets actually feel like. Remember that thread count or something.
Yeah.
Right? Feel that thread count. And then what makes it difficult is that your mind will hey, remember that problem? So you make the choice again. You make the choice again to come home to the body. So you keep doing that and doing that and doing that until it becomes your the word that comes to mind is proclivity, but it becomes a routine to you when it becomes familiar there. So
Right.
those might help.
Ask a question here. I have a question from in terms of sleep. I think it's concerns a lot of people. This is supposed to be a time when we can have as much rest as we want, but we're not getting that rest, right? Because we're, as you said, for a variety of reasons. So I have a question from one of the attendees. What about sleep cycles? Are they real? Like, her sleep cycle, say it's 3 hours and she's still tired after getting 4 hours of sleep because the cycle isn't complete. So would she need to do 2 more hours to complete the cycle? I mean, is that a thing?
Well, there are a lot of different schools of thought kasi when it comes to sleep cycles, like how long should it be, like from what time to what time is the best, I guess, sleep cycle. But it depends. It depends on you. Like, for some people, 5 hours is enough for them. For some people, they really feel like they need to sleep 8-9 hours. Again, it's trying to figure out what works best for you. Now, I'm trying to see the name, but so for the person who asked that question, if you feel like you need more sleep, then definitely go get more sleep, diba? If you can. But try to look at your routine around sleep, diba? Like, figure out what's preventing you from getting more hours of sleep. Is it because of work? Is it because of the things that you need to do? Do you feel like taking daytime naps might be something that's helpful for you? Or have you optimized your sleep yet? Maybe you're eating too close to bedtime, or again, what Vaughn said, maybe there are certain things that you keep thinking about, that's preventing you from getting good quality sleep. And again, when we talk about optimal sleep, we don't just look at the quantity, we also have to look at the quality. Like, the simplest question we ask our patients is, when you wake up, do you feel rested? Diba? And a lot of the times they say no, and it's not surprising, kasi I guess the time we live in now, diba, we always value productivity over rest, diba? Like, I don't know, but maybe for some people, if they're seen napping in the office, like, it'll look like it's a bad thing, kasi parang dami niyang time dami niyang time mag-sleep when there's so much work to be done, diba? But there are some cultures, there are some countries who value that afternoon nap, diba? So
But
again,
how does that translate to a specific pandemic situation also? Because a lot of us are also work from home. You know, we have a
mhm.
work from home situation.
Okay. Siguro one of the most common questions I ask, no, for people who work from home is, where's your workstation? Because if it's in the bedroom, then it's harder for you to delineate that. Okay, my bedroom is where I rest. My bedroom is where I sleep. You kind of associate that area, your surrounding area, with your work, diba? And if it's stressful, or if you're experiencing added stress at work, then it's something that I guess your mind kind of makes a connection with when you're sleeping. Or for example, again, if you feel like you need to take a daytime nap, by all means do so. Because those daytime naps, as long as it's not too close to your actual bedtime, then it's something that also gives you the benefits of a good night's sleep.
Doc Isa, yun nga, coming from everyone's problem where they're not getting enough sleep or they're not getting quality sleep,
Mhm.
a lot of people resorted to biohacks. For
Okay.
example, I'm guilty of them. I'm one of them, basically. I started drinking melatonin.
Okay.
And I'm pretty sure a lot of people are also drinking a lot of melatonin as well. It's been the thread, I mean the topic in a couple of community threads. So how do you feel about that? What is melatonin first of all, and how does it work? How does it really help you get quality sleep? I mean, yung iba naman uso weighted blankets. So a lot of people are resorting to different biohacks. So what do you think will work, and what does it work?
Okay. Sige. Again, siguro we go back to why you're having a hard time sleeping, or why you have a hard time getting that good quality sleep. Pero these things like taking melatonin, it helps. But remember, melatonin kasi is a hormone, is also a hormone. So if you take too much of it, or if you're on it for a very, very long time, then it can also have an effect on your other hormones, the metabolism of your other hormones. But if it's something that you feel like you need to take in order to sleep, just until we figure out what
Yeah,
else can we do,
that's
diba, to
important.
help optimize your sleep. Kasi yun nga, if it's a case pala of I guess trying to address certain fears or certain thoughts, diba, just like what Bon was mentioning, then you can keep taking melatonin until such time that you're able to develop I guess better coping mechanisms, better habits, to help with optimal sleep.
But
Yeah. If
sorry, go ahead.
yeah, go
Go
ahead. No, go ahead. Go ahead.
Just about another question here, just with regards to melatonin. Um, Kara Wilson here says melatonin gives me very vivid dreams and even nightmares. Is that common?
Before we answer, may I chime in before
Yes.
we let the other question go? All right. So with the first question, sabi nga ni Doc Aisa, there are different schools of thought when it comes to this. I'm in the school of thought that um, the beliefs in the levels of sleep. Sometimes what the reason why it feels like it's not so much about the length of it, but where in the levels of sleep, what levels of sleep you're getting, if you're getting the complete levels. Because sometimes, when you try to get some sleep and it's only level 1, and you're not getting the deep sleep, then you won't feel as rested, even if people point out to you, you actually slept. It won't feel as though you did sleep. So that's one. And then about the biohacks lang, I think that was very important what Dr. Isa said, that if you feel like you need it, then by all means do so until we figure out why that is. Kasi if you take melatonin and then it makes you sleep, but again, I keep going back to the autonomic nervous system. If it's still picking up dangers, even if you did try supplying it with melatonin, eventually, if the root cause that keeps it in the sympathetic state is not addressed, then eventually that melatonin won't work anymore, right? And so again, going back to the level of the autonomic nervous system, I love those weighted blankets, right? Because they're so comfy. And the thing is, it puts our, I mean, if I'm being technical about it, it puts really our autonomic nervous system into that state of safety, you know, because when we were kids, that's what a hug feels like. So they could work too. But again, it's important what Doc Isa said, that to find out the root cause of it, right? And so now we can answer the other question. So, yeah.
Like, let me open the chat box. The question is, okay, very vivid dreams and even nightmares. Is that
Yeah,
common?
that's common.
Yeah. Siguro for some, not very common, at least in the patients that I've seen, when my patients tell me that, doc, I started taking melatonin, but now I'm having vivid dreams. Okay, let's try to look at other factors beyond melatonin, because maybe there's something else that happened recently. Maybe it's siguro, did something happen recently that led to you having more vivid nightmares? Because generally speaking, it's not supposed to do that, diba? But again, we need to look at your sleep physiology. Maybe you need melatonin, but the way that your body processes that is different from the usual, different than expected. Maybe you're spending too much time dun sa level where your mind is actually awake. That's why you're having these vivid dreams. And again, when you spend too much time that your mind is awake when you're sleeping, you really don't feel rested when you wake up. Tama ba yun, Von?
Yeah,
Did I express that correctly? Yeah.
Yeah. Agreed.
Yeah, kasi yun nga, like one of the simple answers I give also, diba? Okay, when you talk about good quality sleep, do you dream? Kasi even before I trained in functional medicine, that's what I thought good quality sleep was. Is, diba, if you have a dream and you remember it, then you had a good night's sleep. But it's again, certain schools of thought say that it's the other way around pala. It's like when you don't have dreams, or when you do dream, you don't remember it. I don't know, is that something you believe in, Von?
with dreams kasi parang I quite agree with what you said kanina. It's important to look at what else is happening apart from that, because usually the melatonin or whatever it is might just be I don't know, maybe a conduit. I don't know if that's the right word to use, but usually it's what else is active that might be more responsible for the dreams. But yeah, I quite agree.
Okay, do we have any more questions about sleep? Or
yeah, they can definitely message their questions about sleep.
Okay.
Maybe then this is also an opportunity for us to talk about stress, with the pandemic and all.
Yeah, siguro, I don't know, si Von was already mentioning bits and pieces about stress in the autonomic nervous system. Siguro I just want to begin with, siguro in defense of stress naman, it's not entirely a bad thing. Actually, it's something that your body needs. It's a protective mechanism, diba? If, in what do you call this? Ano ba yun? Itong sinaunang panahon, diba? If it's something that you need to stay protected from, diba, from like wild animals or things like that, diba? When you encounter a situation wherein you need to act, diba? Yun nga, fight or flight. It's the stress that pushes your body to be ready, diba, for anything. Like, your blood pressure increases, so you get more blood to your muscles. Your eyes are wide open, diba, so that you can see better. Your cortisol or your stress hormones shoot up because you need more blood sugar, diba? You need everything awake, your system in your body awake, because you need to respond appropriately to stress. But after the stressor is gone, it needs to go back to baseline, diba? And siguro ito, I'll make the connection na for to make it easier for Von to chime in, diba? But I guess nowadays our stressors are different, diba? I don't think may tigers or like mammoths, dinosaurs roaming around, diba? Not just the physical stressors, but I think it's a lot of the mental, emotional, social stressors that we're dealing with, which is why we're chronically stressed. Diba? That chronic low level stress is the one that can be bad for us, diba? If it doesn't go back to normal.
It's true. And like what I was saying kanina, if you hold things in your mind, maybe not hold maybe hold is not the right word because that implies like as though we want it, right? But for discussion's sake, sometimes we don't do it on purpose, but we do hold these things in our mind that keeps putting our nervous system in a sympathetic state, so that even though the threat, quote unquote, is over, the stress is over, it doesn't go down. And your body, because and the nervous system, because it controls all of these things in your body, like blood pressure, heartbeat, it puts them in that state. So can you imagine if you are in a chronically and perpetually you're held in a stress response perpetually, that will take its toll. Eventually, it'll start showing up as these diseases that a lot of us are complaining about. So yeah.
So, so what happens exactly to your body internally when you're in constant stress? I mean, of course, the symptom or the end result would be you'll have chronic diseases, but how does it work? And yeah, what are the symptoms or the effects of stress typically that people would usually brush off as well?
Can I start
Yeah,
it?
yeah, go ahead.
Yeah, I was just reminded because Doc Isa, of what you said, that a lot of our stressors now are not saber-toothed tigers, or
Yeah.
they're not mammoths or whatnot, but because the autonomic nervous system's function is they're automatic. Parang it's like it's the same way that we don't decide. You know what? I think I'll let my heart beat 5 times a minute, right? So it's not within our conscious choice. So these things, the detection function of it, they also happen subcortically without our conscious choice. So when you're put in that state, it doesn't make a distinction whether as long as it feels like a threat. If the signal that is being received by your nervous system is one of threat, like I can't help but think of the pandemic. Like I've had clients where they're working themselves to burnout because the threat signal is translated in reality as, well, you have to finish this by this deadline or else, right? Because the sympathetic has that flavor, or else. Like if you don't do it, some really unwanted consequence will happen, and so it puts you in that state that, oh my god, I have to do this, I really have to do this, or else I'll lose my job, or I'll lose my partner, etc., etc. And when you're in that state, Doc Isa, parang just chime in here, like because it's a threat. Well, Luis kasi was asking about what happens in the body, right? So when you're in a sympathetic state, the nervous system might feel that you need to respond in a physical way, and so blood, the heart rate increases.
Heart beats faster. Your blood
Because
pressure goes up. Yeah.
It needs to pump that blood and supply that oxygen to all these parts of your body, just in case you need it, just in case. But we never quite need it, because we don't need to function in a we don't need to respond in a physical sense. You're just talking to your boss, but your shoulders, my goodness, they're tense. Your muscles are tense. Like you're actually facing the tiger, and the tiger is in heels, right? So yeah.
Yeah. So I mean, I agree with you. A lot of the stressors right now aren't really the physical stressors, I guess. Diba? They're not the danger signals that would what do you call this? That would mean that we need all of the physiologic changes that's happening in our body. Diba? When we sense that we need to either we are on a fight or flight mode. No? So again, your heart beats faster. Your breathing also gets faster. Diba? Your blood pressure goes up. Your cortisol hormones, they go up. And when that happens, diba, your blood sugar shoots up. It changes the way you metabolize sugar, wherein you break down protein, you turn that into sugar. No? So I guess It's let me see if I can try to put a visual picture here. It has the same effect as when you are taking steroid pills for a really long time, diba? It's what we call the Cushingite syndrome, and this is why we don't want our patients to stay on steroids for a very very long time, because they have problems with blood pressure, they have problems with heart disease, they have problems with mounting an immune response. Because if your cortisol is high, diba, if your steroids, or if you're taking steroids for a very long time, it depresses your immune response. No? For some people, it can also have mental effects. No? They get mood swings, they get depression. They're also more prone to anxiety attacks. No? They're more aggressive sometimes. No? So because in states of stress, no, your cortisol level is always high. It also affects the metabolism of your other hormones, diba? Yun nga, for insulin and blood sugar, definitely has an effect. But also for sex hormones, no, estrogen and progesterone. Kasi the how do I say this? The what do you call this? The ingredient that you need to create your steroid hormones, no, your cortisol and also your estrogen progesterone, it's the same thing, no. And if your body perceives that you need more cortisol because you're in a chronically elevated stress situation, it takes yung ingredient na yon and it shunts it to cortisol production, no? And the end effect there is that you also get an imbalance in your estrogen and progesterone. I don't know if people have noticed this, but this is why in recent times, there are more cases of endocrine problems, no, when it comes to female hormones like polycystic ovarian syndrome, infertility, what else? A lot of hormone-related cancers, breast cancer, uterine cancer, even for men, no, prostate cancer. So these are just some of the effects of too much stress.
You know what, Doc Isa, that's so true because a lot of patients who are coming in our clinic, most of them have hormonal imbalances.
Mhm.
Whenever we would look at their stress levels or cortisol levels, it doesn't really go down even when they're about to sleep,
Mhm.
which is a bad thing, right? Basing it from all your lectures, etc. I mean, I think, diba, cortisol, if you can't control it, it's a domino effect to all your other hormones. And
Oh yeah.
again, your hormones is like this big, huge, it's supposed to be like in symphony. It's like it's supposed to be in harmony. So if one note or one instrument is playing too much, the other hormones or the other instruments are trying to keep up with the other one just so that they won't drown out.
Mhm.
Is that correct? And then that's
Absolutely.
what triggers or that's what drives also one of the factors that drives also hormonal imbalances. Is that correct?
Oh yeah.
Yeah.
Yeah. Absolutely.
And just to illustrate what Luis said, when it comes to depression, for example, kasi if there's too much cortisol for a long time, we're talking years, like your brain is steeped in cortisol, it actually shrinks the hippocampus,
Mhm.
right? It stops that plastic property of the brain to recover. So until the threat and the cortisol level goes down, it won't recover. It won't
Mhm.
recover. Yeah.
You know what, Vaughn? It's
Mm.
very scary because a lot of us don't even know that we're chronically stressed,
Oh yeah.
that we're all in constant fight and flight mode. I remember this also, this patient. She went inside, she took our stress monitor recovery uh, machine. And when we were looking at and monitoring her results, she went to watch, I think, The Incredibles 2 with her nieces.
Kids. Yeah.
And then, funnily enough, her stress levels were high and she only watched a movie. So that's why it ties up with what you were saying earlier that sometimes, even though we're not facing a mammoth or a tiger, the body perceives it differently and it jacks up your cortisol because it thinks it's under danger.
Yeah.
So which also makes me uh, want to ask, how can we control our stress? Like, what's the best practices out there right now? You mentioned meditation, but I'll take it. Please.
Yeah. Well, from my end, I'd say that it'd be really good if you became familiar with your own autonomic responses. That's like saying befriending your autonomic nervous system. Know your own patterns. What puts you, because technically there's like three states that the autonomic nervous system is in, right? Well, safety would be one, or mobilized state where, fight, flight, or immobilized, self-preservation. So it'd be good, apart from, those practical skills like meditation and whatnot, it'd be good if you start becoming familiar with your own patterns. What puts you in a safe state? What puts you, or actually knowing first where you are most of the day. It's like what you said, people don't even know that they're stressed, so that the safe state feels weird. When they're actually safe, they think that there's something wrong and that they have to go back to feeling, I don't know, the Tagalog word that comes to mind is aligaga, like, because that's their familiar state. So it's good to know where you are and then what keeps you in those states. Yeah. Doc Isa, would you like to?
Yeah. I super agree with with what you said, no? And especially highlighting the fact that it depends on a person's perception of stress. Now, well, this is normal for me, or I'm okay. I don't feel like I'm extra stressed. But for example, no, for patients that we see, we ask them to fill out a questionnaire, like a symptoms questionnaire, and then it shows there na parang, okay, these are clues that this person is under a lot of stress. But when you ask them, no, I'm fine, I'm okay, diba? And this is where you start to uncover the reasons behind it. Na, yun nga, maybe it's not, it's the way they perceive the stress. Which is why it's very important, first and foremost, to become self-aware, diba? To understand what symptoms you have, what lifestyle factors you have, how is it affecting you, diba? What changes need to happen, what changes are you willing to make, diba?
Mm-hmm.
Yeah.
Sorry. Someone's calling. Okay, so what are a lot of people also experienced anxiety attacks last year. It's very surprising. And what are the usual triggers of anxiety attacks? Is it food? Is it stress? Or it's a combination of everything?
Yeah. Should I take this one? Yeah, agreed. It's a combination of all of those things, but our individual context kasi has a lot to do with it as well. Like just I'll always go back to familiarizing your own thing, because sometimes when you don't know that you're chronically stressed, you don't know you're chronically uh, kept in a sympathetic state, anything can cause anxiety, because it's so easy to be in an anxious state. It's easy to fall in anxiety rather when you're always in that sympathetic problem solving fight flight mode. So it's good to know what puts you in that state, so that your actions to address the anxiety will be better informed, and they'll be more effective, and they'll be longer lasting. Yeah, so that's my 2 cents worth about it.
Yeah, and I think we also need to understand what how should I put it, are you more prone to getting anxiety attacks? And again, it's understanding the biochemical and physiologic processes that's happening in your body. And again, you can also look at the modifiable lifestyle factors that you have, diba? For example, because we're going to talk about nutrition next. For example, some people experience anxiety when it comes to eating, diba? And again, you look at, okay, why is there anxiety when it comes to eating? Is it because they feel constrained that they need to follow a certain diet, or they feel pressure from other people na, oh, I shouldn't be eating this, I should be eating more of that, no, etc. And again, we can leverage these other modifiable lifestyle factors to help with stress, to help with sleep, diba? And we also need to understand that there's a connection. Like, for example, if you're you're undergoing too much stress at this point, then you're more likely siguro to make not the best choices when it comes to food. Kaya meron tayong comfort food, di ba? Tama ba yun, Jason? Feel free to just chime in.
Yes, thank you, Doc Isa. Tama yun. Meron naman tayong mga tinatawag na comfort food eh. And maybe, while on the topic of stress, maybe I could just give some examples of food items that could serve as a different type of comfort food. And maybe Vaughn also could add on some of the things that I'm gonna say, because this is usually what I say to clients that are usually feeling really stressed. I tell them, make crunchy snacks. Kasi diba, I don't know if you know it. I don't know if everyone also agrees with me. Sometimes or oftentimes, crunchy snacks also stimulates the release of the anti-stress hormones like serotonin. So what I usually say is, go for the crunchy snacks, but not the bad kind. Because if we go for the bad kind, maybe it would add more to our stress also. It could have an effect. So to give everyone an example of what good food ideas you could do for as an anti-stress snacks, maybe you could name that as an anti-stress snacks. So you could go for nuts, for example, especially walnuts that are high in omega-3, because omega-3 also, diba, promotes your brain health. You could make a trail mix, something like that, like with walnuts, dark chocolates, the 70% above dark chocolates, and seeds also that are high in omega-3, which could really help stimulate brain health also. Then snack on it, continue eating it. I guarantee you'd also like it in terms of the taste, and it also can really help in alleviating stress. Do you agree with that, Vaughn, that it helps release serotonin?
Yeah. Because like I said, it helps to send signals to our brain about these things, and I think that's the mechanism behind it. That's why if it receives that kind of signal, then it would be easier for our brain to release those hormones. Yeah, I quite agree.
So the next topic would be movement and exercise.
Yeah, okay. So I think what I'd like to begin with in terms of movement and exercise is that you don't have to be like a gym buff or like a triathlete or something like that, no? To say that, okay, I'm doing my share of making sure that I'm exercising enough. The only thing you need to do is stop sitting so much. Okay? I get it, diba? When we're working in an office, or even when you're at home, diba? You're working from home. Let's just say that for a great number of, a great portion of your day, you're sitting down. Diba? You're on your desk typing in your computer or something like that. Unless, I don't know, unless your job is to like walk around. I don't know. But most of the time, diba, you're just sitting down. Let's just say na 8 hours at least. And that's way too much time. And there's a saying in the functional medicine circuit that sitting is the new smoking. Why? Because prolonged sitting, too much sitting, or too much inactivity actually increases your risk for heart disease more than smoking. And that's huge. Diba? In the past, we would always say avoid smoking because it's really, really bad for heart health. But this time, avoid sitting too much. No, and not naman to scare people na it's a bad thing na you're working on a desk. But just make sure that it's not, diba, you're not sitting for the duration of 8 hours. Make sure that every hour you're standing. Make sure that you're doing some light activities, you're moving around. And I think this is also something that Doc Rona mentioned. Just make sure that keep moving throughout the day, whether you walk outside, or you walk to go buy something in the store. If you're in an office, you walk to other areas, walk to other departments, assuming that that's something allowed, no, because of the because of the health protocols, because sometimes they ask you to just stay in your own office, but I guess you can just walk around the office, things like that.
Yeah. And just to add, no, but it's important to remember that we as humans are designed to move, right? Like if just tying it up with psychology, when you're depressed and you're just sitting down and all of that, lying down, it's encouraging those behaviors that make you avoid stuff and really just puts you firmly in that state. So adding movement actually activates a certain area in your brain that encourages approach behaviors. It's why walking works. It's why exercise works against mood disorders, because precisely for that reason. And movement is so effective when it comes to our affective states. Yeah, so I quite agree.
But yeah, actually coming from another webinar the other day, one of our fitness coaches also warned people that, of course, there are a lot of people as well, other patients that we have, that are so obsessed with working out that they work out excessively, and it does more harm than good now. Is it true?
Yeah, I guess just that general principle of, too much of anything can actually be bad. It really is good to remind yourself what your intentions are, right? So if you are self-aware, sabi nga ni Doc Isa, about your intentions, then you'll know within yourself, and then you can regulate and make the necessary modifications to your own behavior. But oh, wait a minute, I think I'm exceeding what is actually needed. So time to relax or something. Yeah.
Yeah, absolutely. And again, we're going back to the concept of what do you call this? It's always personalized. No, yeah, we get a lot of these guidelines, these recommendations when it comes to exercising, when it comes to working out. Like how many reps, like I don't know if I'm saying that correctly, but yeah, how many reps,
Yeah,
how
I
long,
think
like
so.
how many hours in a day you should be like what kind of high intensity exercise you should be doing. Again, it should be tailor fitted to you, because not everybody can just go from sitting down for 8 hours to high intensity agad, diba? It's different, no? For some people it's gradual, for some people it's easier for them to go straight to that. But again, it's different for people, and when you're exercising too much, you're subjecting your body to too much physical stress, no, in terms of exercise. There can it can create too much inflammation, too much oxidative stress, which in itself can be damaging, to your blood vessels, to your muscles. It can affect a lot of the other nodes. Balance is the key here. It's very difficult to say, kasi for everyone na, okay, when you get to this point, that's too much exercise na. It's we need to assess where you are and what the right amount of exercise is for you.
So definitely before we subscribe to another session of HIIT or buying a whole package, we have to consult with you first. But also, a lot of people ask, is exercise good for mental health? I remember this was also another question. How good is exercise for mental health? Because I think it releases some hormone.
Yeah, that's what I was referring to a while ago. That it's how movement affects our emotional states, because it encourages areas of the brain that make us do more approach behaviors, and so that entails releasing these hormones that are actually needed for that particular behavior. And it's also how, like, when you get used to it, when you get to a certain when you get used to a negative behavior that's not really helping, your neural pathways for that behavior become stronger, right? So the key is to activate, not to deactivate it, because the only way to deactivate that is to make new neural pathways for a much healthier behavior. And exercise certainly can be a quote unquote gateway to that.
Bambina, I think there is a question, or is it? Can't seem to.
There's a question here. This is for Jason. You were talking about food and how food helps with, stay sane and stay healthy. How does the elimination diet help with eczema or any skin conditions?
Oh, okay.
Jason.
Yes. we will discuss it later in full detail in the nutrition note, but to give everyone an idea on how skin issues, or maybe we could term it as inflammation, have an effect, or inflammation have an effect on I mean, food has an effect on our eliminate or in inflammation. So you could think of it as somewhat this way. I believe Doc Ron last session already mentioned the gut microbiome, and also Doc Isa also mentioned earlier the different nodes, the gut, the roots, everything. And I'd like to add on that. This is what I usually tell my patients and clients to make it easier to visualize how food plays a part and in our issues. For example, in this case, eczema or other skin issues. So you could think of our gut and our gut microbiome as somewhat like a checkpoint. So it is the final stage before everything, the food we eat, the food being digested, is being distributed to the different parts of the body. However, sometimes, or most often times, the gut checkpoint is not that healthy because there are many factors that could have an effect. It may be the food we eat. Maybe the food we eat is some form of triggers, or maybe it could cause some reaction in the body. And if those food items, usually the undigested ones, are being passing through those checkpoints, it is being distributed to different parts of the body. It could trigger different symptoms like your skin issues. So elimination diet, what it does really is it helps us, or it removes the common triggers of the food items. So if food is really the what do you call this? Maybe Doc Isa could add on also the deeper side on the maybe Doc Isa could have an addition also in how do you call this, in the functional medicine side, because I'm gonna speak on the nutrition side. So usually the food we eat could cause different triggers also. So what's the main reason with the elimination diet is we remove the common triggers of symptoms. So if the food items we remove is a trigger, hopefully, definitely if in terms of food, in terms of the food we eat, the skin issues could really lessen. Do you agree with that, Doc Isa also?
Yeah. I think you said it perfectly. When it as far as the connection of the food that you eat and the inflammation that's being manifested on your skin as lesions, diba? If you have eczema, again, remember that gut health is one of the nodes that I was showing earlier, no, in the functional medicine tree. And gut health, immune system health is another node. And again, they're interrelated in the sense that your gut lining has a role in your immune system, no. So if for example the food that you eat is causing a problem with your gut, diba? It'll also cause a problem with your immune system. More often than not, that's manifested as too much inflammation throughout the body. And the way that manifests is unique for each individual. It can be in the skin. You have eczema, or it can be for mood changes. It can be, you get bloated, you get constipated, you get diarrhea, things like that. And when you go on an elimination diet, diba, that's when you remove or avoid temporarily these food triggers so that you give your body some time to rest and to recover, kind of allow your immune system to calm down, so to speak, so that your body has a chance to heal itself, diba? A lot of the patients that have skin lesions, they improve when they avoid food sensitivities or food triggers.
Yeah, Doc Isa, that is correct. Also, that's good. Kasi, and also another thing also that we must remember with the elimination diet or food in general, that's correct. That it's just one of the nodes that we have to look for. Food alone is not the answer on what we're doing and the issues that we are experiencing. It just is one of the different factors, and hopefully, if we could start with food or start with one of the nodes we could hopefully target, it could cause a cascade of reactions that would be beneficial in our overall health also.
Okay. Um, Hold on. So let's talk about actually relationships. So how does relationships or your beliefs interact with your genes, as you mentioned earlier, Doc Isa?
Okay. So actually, there are a lot of studies that show that the quality of your relationships or the effect of your relationships can change the way that your genes are expressed. No, in the same way, I can't give a specific gene that's affected by certain relationships. But for example, if we're talking about the quality of your relationships and the habits that you have, that also have an effect on the expression of your genes. Like for example, if you live in a household that's always eating fast food because that's what's convenient, that's what's available, um, diba, that influences your genes in the way that it will make you express uh, a more predisposed risk for certain conditions like obesity, diabetes, hypertension, um, yeah, things like that. So or for example, if you are uh, in a toxic relationship, so to speak, that changes your mindset, which of course can also affect your mental, emotional, spiritual center, which in turn have physiologic and biochemical effects on you that again affect one or several different nodes, whether it's inflammation, whether it's gut health, detoxification or biotransformation, uh, yeah, things like that.
Mm-hmm.
Yeah. And if I may add, because I think uh, you can't talk about relationships because are so intrinsic to us. Like, like we need relationships to survive. Like literally, if you're a baby, you need a relationship with your mother, right? And again, I keep going back to the autonomic nervous system because it's being shaped by relationships. How you relate with other people has a lot to do with your life experience of relationships, and I'm talking like way far back when you were born, because like I said, the nervous system, which is a detection system that's always on in relationships, is shaped by the relationship that you have. So can you imagine, like, I can't help but think of couples problems, for example, because if any of the couple has a dysregulated autonomic nervous system that somehow misinterprets any signal that comes from their spouse or their partner, so that they're coming from two different places, they're speaking in two different planes. Like I remember clients that because I saw them interacting, right? So the one partner would be like really leaning forward and trying to explain her side, and then the other partner, the guy just goes like that. And so when I asked, all right, so when like if you ask her what the leaning back means to her, she says he's leaving. But really what the guy is getting is that it's he's reacting from how his nervous system was shaped, right? So that he's doing that, and that's not so. When he heard what she interprets, she goes, no, what, no, I'm not leaving. It's just that the way they're interacting from their dysregulated state makes their relationship, well, for lack of a better word, hell, right? Because they're not meeting, they're not in the same frequency. So fixing relationships are vital, fixing relationships, but sometimes fixing relationships also means fixing you first, right? Because that's the whole, I can go classic here and cite Erickson when he says that those developmental stages, you can't get to that stage where you're ready to share yourself with another if you didn't, quote unquote, fix yourself. So there's that too.
Especially now that everyone's stuck at home,
Oh yeah.
right? You're exposed to someone 24/7. now, and you're
Which was a revelation, by the way, for a lot of people.
exactly. So, you know, you can't help but actually butt heads and from time to time. But again, to your point, it's very important to keep the relationship and make sure that you would hear each other and work on yourself, right? So let's move on to the nutrition part because a lot of people are excited about that. So, you know, Filipinos love to eat. Okay, so well, with nutrition, a lot of people ask, what is the gut? Why is gut health so important? And for me, honestly, before working for life science, I've never really looked at gut health that much. It's for me, it's very overlooked. What can you say about that, nutritionist, dietitian, and chef?
So, ayun, first of all, that's really a given example, or that's really a proven point that people ask or people forget about. People really think about gut health is, yun nga, gut is just like the main role is it really just helps digest and absorb the food. It's just there to help us digest and absorb. But yun nga, gut health is important also, or other factors that you consider to the gut is that it does more than those things. So are listed here three. It is home for gut microbiome. That is already we talked about briefly on the gut health. And next is the communication center for the brain. Sir Von also could, I think, attest to this, the gut-brain connection. Kaya nga, di ba, we have this saying that I have a gut feeling, we have a gut feeling. So what the gut feels, definitely the brain feels, and what the brain feels, definitely feels vice versa. And I believe one good example that I could take away from here is this. Remember, we have cravings. We have cravings. So this is what I usually tell clients if they, how do I, they always ask me, how do I combat cravings? Because sometimes really I have a bad craving. What I tell them is sit up straight, take a deep breath, and feel where the craving is coming from. If it's coming from the gut, it is physiological hunger. You're really hungry, so you need to eat. But if you take a deep breath and the hunger is still something feels like in the brain, it's psychological hunger. What you need to do is think about what are the things you're doing right now. Maybe there is something that you are doing, maybe contributing to making you want to eat. For example, what I can relate is watching TV or watching movies. It's often sometimes associated that every time you watch something on the TV or internet, we need to eat. Isn't that right, Sir Bon?
Yeah, I quite agree. When you said nga, the connection between the brain and the gut, what came to mind it was gotta love the vagus nerve.
Yes.
That's the connection there. Yeah.
Yes, and the last one is the front lines for fighting diseases. I believe Doc Isa has already mentioned it earlier that gut health is not oftentimes associated with our immune system, but it also plays a key role because it houses different types of hormones or enzymes or different things that are needed for immune cells and immune practices also. And what I usually also tell, Puro, I'm just speaking from what I usually tell to the patients. Our gut is sometimes like a key, and beyond that key is the different root causes that we need to discover. We need to decode, or we need to open that chest. Pag nabuksan na natin yan, we could have a starting point on what we could do. Yun nga, doon papasok yung sinabi natin earlier, that the gut health, like how do you call this? That our gut, the food we eat, has major roles in the different symptoms we are experiencing, we can be experiencing. And there are many factors also that could be contributing to our gut health also. So, or our gut not being healthy. It's already, the other panelists have already mentioned it earlier, but maybe I could reiterate or add some things more. So common factors that could be affecting our gut health is also improper food choices. Yeah. What food we eat. Maybe we are eating food items that are pro-inflammatory, or maybe we are preparing the food items in a pro-inflammatory way. And one of the things people don't associate with inflammation is usually frying food. Really, frying food items is really inflammatory. To put it simply, the more the food is brown or the more the food is golden brown, the more it is inflammatory. What I'm saying is, I'm not saying that you should not eat fried food item. It really depends on how you prepare the item. Because it really plays a part also. Next is other factors that could contribute. Ayun, I believe maybe we could skip on that, Ms. Louise. Maybe we could doon. Yan. This is what dito tayo lilibot. Dito tayo lilibot sa parang pinaka-discussion ko. So I believe what we can do to heal the gut. So if both Vaughn and Dr. Isaac add on to this if they want also, because I'm just gonna speak on this in the nutrition side. So first thing we need to do to heal the gut is what we call the 5R protocol. So there are 5 R's. So what I say is picture everything like this. Our gut is like a machine that if there is something not right, we need to remove the cause of the issue. So that is the first R. So remove. What we can be removing is anything that can be irritating in the gut. This may be in the form of food sensitivities, food intolerances, food allergies, and even processed foods, especially processed foods rather, not including processed foods, because our body is not that trigged to process all those food items. Imagine it this way. So think of what our grandparents used to eat. But they don't eat that much of processed foods. Usually siya, how do you call this? Diba? Everything is whole foods. So it's really on their purest state. So as much as possible, eat everything in that state. Next R, please, the next one. So replace. So we already removed possible food triggers. So yun yung parang first step natin. Remove everything that could be a suspect. Next is replace. So replace those things we remove with whole food alternatives. So this would be target increased vegetable intake, healthy fats like your omega-3, and meat choices. So for meat choices, meat is okay. However, we must go for those how do you call this? Lean varieties, because the normal types of meat, the regular meat we eat, are high in saturated fat, and saturated fat is also inflammatory. So doon siya ikot ng ikot na we need to lessen inflammation also. Next, please. Inoculate. Maybe I also see here a question that pop up pala sa akin sa screen. So how do we maintain a good relationship with food when you're on an elimination diet? So I believe that is a question on what are your alternatives? So usually when we associate elimination diet, we just remove everything and we don't have an alternative. Depending on what food items you are avoiding, or depending on what you remove, you have lots of alternatives. Let me give you a good example. So this is parang papasok dito. This is a simple recipe that you could do. I'm gonna give everyone a simple recipe. So eggs. I bet everyone here eats scrambled eggs. Who does not like scrambled eggs? So this is a substitute, what I usually say. Kasi medyo mahirap eh. If we remove eggs in our diet, what do we eat as a substitute? So what I suggest is what you could try this. Everyone could try this at home. Scrambled tofu. Have everyone tried that? So scrambled tofu, what I suggest is, in recipes online, they say the regular tofu, but this is based on experience. I go for the silken tofu, the soft tofu, then I scrambled it. Then I put, how do you say this? I put a special type of salt. Actually, this is not special naman. This is common even in mga Indian cuisines or even sa mga stores online, black salt. If you sprinkle it there, it has a, how do you say this? An amino acid there that makes the salt, when you sprinkle it to tofu, makes the tofu taste like egg. Really, I promise you, it will really taste like egg and you really like it. There are a lot of alternatives. Talagang kailangan mo lang explore on different food items you could do. And what you could start also to make it not difficult or to enjoy your elimination diet is think of the food or think of the cuisine you like. Maybe you could start, for example, Korean foods or Filipino foods. Then from there, check what you have. Check what you could eat. Because there are lots of alternatives you could try. Going back here, reinoculate. So this is just two parts, probiotics and the prebiotics. So we, aside from removing, replacing, we need to reinoculate or add more. Add probiotics because this is the good bacteria in the gut, which could help in building back the wall integrity of the gut. And we need to add prebiotics. So yung prebiotics naman, this can be serving as the food of the good bacteria. So if you look at the picture, in the left side, those are the kefir, the milk choices, yogurts. Those are your probiotics. Another good source of probiotics are fermented food items. And the prebiotics are usually coming from food items that are high in fiber. So those are your vegetables, fruits, and also grains. So next, please. So repair. So dito din papasok again, going back, how could we enjoy the elimination diet? So one thing we could do is, tingnan niyo yung picture, it's somewhat like a rainbow. So again, eat a rainbow. Don't stress yourself. Maybe kailangan ko specific food items lang. Maybe kailangan ko ito lang kakainin ko. What you could do is, keep it simple. Eat a rainbow every day. There are a lot of food items that is like a rainbow. So let's go for Filipino. So one of the Filipino food items that are rainbow in colors, chop suey. Okay, yeah, you could go for the different, how do you call this? You could go for one dish meals like sinigang. It has a lot of colors already. So eat a lot of things that you like in terms of the rainbow. Next. So last is the rebalance. So we eliminated everything, we tried everything, we removed, we replaced, we inoculate, we also prepared everything. Next is we need to rebalance. Dito papasok yung everything has, the Isa and Fawn has said that everything plays a part. Think of what you need to do next. Don't just focus on the food, because maybe if you focus on food, it would make you feel stressed. And that is something all of us, I think Doc Isa and Sir Juan would agree that we don't want you to feel stressed when, especially when doing the diet, because removing the food items you like is really stressful in its own self. So rebalance, think of what you could do to make you feel better. Maybe you could invest in relationships with your family. Maybe you could, what strategies you could also do is invite them to do it with you. Para you'll not feel that you're not alone. You could have a support system that would help you guide and encourage you in everything you do. So
Sorry,
yun.
but I super agree with you. You know what? Whenever I go through the elimination diet, it really helps when you're surrounded by your family or friends who also go through it. And it's so fun because, well, the main benefit of having you guys as part of the ones facilitating the elimination diet is, again, as you said, there are a lot of alternatives, and you always guide us on what alternatives will, be good and will help me feel less deprived when I'm going through the elimination diet. Because I'm telling you guys, I mean, a lot of people are so scared to go through it, but if you have really good guidance and you have a good care team behind your back, it'll be a breeze. I mean, I love coffee, I love milk, but because of the nutritionist-dietitians that we have, they were able to give me a list of suppliers and alternatives that, I was able to still enjoy my milk with that healthier milk and coffee every morning and still not feel deprived, and I don't get cranky. So there. Next slide. Oh, we do have a question here, Jason. I'm experiencing bloating after every meal. What does it mean?
Okay, actually, that is a good question. I'm experiencing that you are experiencing bloating every meal. What does that mean? First thing you need to do is think of what did you eat that day. So parang what you're gonna do is parang you're gonna find the suspect, because if you eat on a regular basis, I guess it would be easier. For example, I'll use myself na lang as an example. Kasi this is the funny thing. When I joined life science, I didn't think of food as the cause of the bloating, everything. So what I did is I also, out of curiosity, I tried to find out the causes of my symptoms, and I was really bloated before. So I listed all the things that I eat on a regular basis for that day when I felt bloated. Then and I ate a meal that, let's see, rice, bread, eggs, then tomatoes. So let's say that's the 4 items I suspect. I ate rice without the bread, eggs, and tomatoes. I didn't get any bloating. Next thing I tried is bread without the rice, eggs, and tomatoes. Nothing happened. Same with eggs, nothing happened also. What is left is tomatoes. So when I ate tomatoes, wow, I felt bloated after. So after that, yun, I tried to avoid tomatoes, so the bloating subsided. So that is one thing you could do. You could identify, just look at the food you ate that day. Maybe one of those is the trigger of your bloating.
Question though, Jason, about chocolate.
Mm-hmm.
Do you recommend chocolate, and any type of chocolate allowed in the elimination diet?
Okay. In terms of chocolate, there are many types of chocolate. That is right. So, ayun. In chocolate, you must look at it. What I try to ask is, if you're going for the processed chocolates, as much as possible, don't eat it because it has a lot of ingredients. So what we usually associate with milk chocolate is it contains milk and the cocoa beans. That is the thing we associate with it. But if you look at the ingredients, it still has a lot of things. Sometimes my malt, my soy, my wheat. Then you think, bakit nandun yun? Why is it there? So it may have an effect on your elimination diet also. So in terms of what chocolates you could take, it depends on if you could take in chocolates in your elimination diet. But if you can, go for the unprocessed ones. What I usually recommend is the 70% above, because usually they're already dairy-free. And usually in elimination diet, you need to avoid dairy also. So that is just a safe bet. Go for the 70% above, or even just go for the tablea itself only.
The cacao nibs. That's
Yes, also the cacao nibs. That's good. That's great. I tried it and I like it also.
my personal cheat whenever I go through an elimination diet is just stick to the side where there are no processed food, aka the aisles. I try to stay away or stop myself going through inside the aisles of processed foods and just stick in the sides of the supermarket where there's the fresh produce and fresh meat, and you're good as long as you try not to eat or grab things from the processed food aisle, then you're good. Okay, so moving, the food intolerance test. You want to quickly go through it, and then let's move on to other Q&As. Or I think a lot of people also already asked already. But yeah.
Maybe we could run through very quickly the food intolerance test. Remember the first R that I said, the remove? Actually, there's one thing, not one of the things that you could do to make it specific. Because sometimes what I often encounter is people say, elimination diet didn't do anything with me. Because that is a general. Dun papasok yung what Doc Isa and Sir Von said earlier, that it is not health in general really is not a one size fits all. One thing may be applicable to someone, the next thing would be not applicable to you. So this is just one thing you could do. So the food intolerance test helps us identify or target which specific food items we need to avoid. But generally, the concept is still the same with the elimination diet. So, Ms. Louise?
Okay.
Sorry,
So
can I just add?
go ahead.
Short lang. I just want to, add siguro another benefit of, diba, knowing what your food sensitivities are. It takes away the guesswork. Kasi the elimination diet is based on removing the most common food triggers. But again, it's not one size fits all. There are some people who might be sensitive to wheat but not to dairy, diba? Or they might be sensitive to egg whites but not to egg yolk. I mean, I don't have a very logical explanation as to why that is, but there are just some people na ganun sila. No? And for example, if you're someone who is dreading to remove dairy from your diet, ano, for all you know, when you do the food intolerance test, you're not naman pala sensitive to dairy. So, pwede siyang nasa safe zone. Okay? And again, what we like to say when it comes to the elimination diet, it's not a permanent thing. Right? And when you go through the elimination diet, it's not forever that you can't have milk, for example, diba? If you're sensitive to that. It just means that we need to, to start taking steps to help your body heal itself, no? Whether it's doing the 5R, gut repair protocol, or, addressing your lifestyle factors, trying to figure out what the root causes are, no? So that we can minimize your food sensitivities. And then, again, I'm just going back to removing the guesswork. I just want to share that I had one patient who was surprised that she was sensitive to avocado pala. Kasi diba, like avocado is all the rage right now. Na parang, healthy food, no? Kaya lang, what happened was she kept eating a lot of avocados, but she had problems with her gut health pa. So yun, lumabas si avocado sa food sensitivity niya. No? I mean, when we explained to her naman why that happened, no? Because that's what your immune system is exposed to, because that's what you're eating very frequently. She understood naman, and we did the elimination diet, and then we assessed afterwards, and she was fine with the avocado. So yun.
Sometimes all it takes is a bit of rest from your favorite food items.
Yeah.
Yes, and also just a quick add on that. Usually, what I also say that that's correct. Elimination is temporary. You could just think of it. Your body is just telling you that just take a rest of eating these food items. Maybe you could try these different food items, so you'd have a more expanded food list that you could try. So it also helps as a way to expand our food choices also.
Mm-hmm. And speaking of the food intolerance test, we have 3 winners today. Who will get their free food intolerance tests from Life Science? So the winners are Grace Axalan, Carol Tigson, and Micaela Bastin. So all you have to do is email ask@lifescience.ph. Oops.
Sorry, Luis, you went on mute suddenly. Anyway, yeah, our winners would just actually you can email us at Manila House, and then we can connect you to Life Science to claim your free food intolerance tests with a value of 11,380. 380, yeah.
Yeah, we did the price increase last March. But we're not going to limit that to the 3 winners, because exclusively for the attendees here, and you guys can get a 20% off on life science supplements when you book a care consult with, let's say, Dr. Isa or the rest of the care team. You just have to book a consult and you'll get a 20% off on all life science supplements. You have to use this promo code MH20SUP. So you have to use that. You'll also get 50% off on the food intolerance test only until March 6, 2021 at 6 p.m. So you can use this promo code also, MH50FIT. Don't worry, we'll send Bambina all the promo codes as well, and all the promos that will be exclusively offered to you guys, just so that you can book your very own food intolerance tests and supplements and consults, as well as everyone can get a free 15-minute consult with a member of our care team, with any member of our care team. You just have to use this promo code as well. And also we have IV therapies or IV drips. So you get also 20% off on that. Only until March 6th is so if you have to book now and schedule it. That's it for me, Bambina. Don't forget to subscribe or follow us on Instagram and Facebook. We have a YouTube channel as well. Thank you.
Yeah, thank you everybody for joining us today. That was a really comprehensive talk of all different aspects of health, mental and physical, plus nutrition, which all work as, if we don't know it by now, we should realize they all work together. So a holistic approach really is, I think is best. There are a lot of challenges we're facing during this time, and there are ways to deal with them. So for example, at Life Science, always people you can talk to. Or now if you understand your triggers and you can understand what keeps you, for example, from sleeping or what gives you stress, then at least you have a little bit of an idea of the tools at your disposal to to tackle them and be on your way to better health, especially as we go through the tail end of this pandemic. And we just have to hang in there a little longer, um, hoping for herd immunity, obviously. But herd immunity or no herd immunity yet, we still have to adhere to certain basic principles of good health and good nutrition, right? Vaughn, I was thinking maybe you could give a holistic kind of summary as well before we close.
Yeah, sure, sure. And maybe Doc Isa can chime in as well. It's I think what we can get out of all the discussion here as well is that their health really has two sides. One is physical and one is mental. That if you ignore the other, then the other is affected too. So what's important is to address both of these as much as we can, so that the like what you said, the effect is also holistic. Yeah. Doc Isa?
Yeah, and just to add to that, again, it's always individualized. It's personalized. There's no one size fits all approach to all of this. We can make it personalized by looking at what your current health status is. We can look at lab tests, lab results, what you're feeling, what you're thinking, and then look at how you respond to that, and make necessary adjustments. And of course, we need to accept that it's not, it's a journey, diba? It's not, something that you do today, you'll be fine tomorrow. It's something that you need to start cultivating, and you need to be able to sustain for a long time, I hope. Yeah, and our role really is to provide all the support that we can give. Making up-to-date suggestions, cutting edge practices, and interventions that we can make available to people.
Great. Jason, you want last few words?
Yes, this is just again to add on what Vaughn and Ms. Isa said. Um, just really don't hesitate to ask questions. So I believe one of the taglines of our company is "No more Doctor Google." So you could really go to our care team, and we are really we would really answer your queries the best way we can, so that it would be easier for us also to achieve our health goals. So yeah, that's the last of what I want to say.
Okay, thank you so much, Louise, for partnering with us today. On behalf of Manila House, I'd like to thank everyone who's here. And you can catch the talk, for those that missed it. Well, they can catch the talk on YouTube, which will be up in a couple of days. And also, we'll be carrying life science supplements at Manila House, and we have a new online ordering service for all retail items and all takeaway items. So make sure, if you haven't enrolled yet, make sure to ask us for your code so you can sign up and just order online now for all food and retail deliveries. So thank you everybody again for joining us today. It was a pleasure to have you with us. And we hope to see you in our next talk. We have a talk tomorrow about a discussion about art with 4 artists who are actually members of Manila House and their current exhibition. It's at 5 p.m. tomorrow. It's called Detours. And so that's it. With that, I'm going to say goodbye and have a good evening, everybody. And see you next time. Thank you to our panel.